Good afternoon to all of you. So, आज तो मोर class नासिले किंतु I just want to take your class on PSM theory. ठीक है से हमार basic class ना आरो like we will have just 2-3 class নহলে এটা দুটা class আমাৰ just বাকি আছে তো এইটোই class নহলে আমাৰ শেষ হৈ যাব syllabus ঠিক আছে actually time period বহুত কম হৈ আছে আমাৰ in our portal okay in our portal the slots that we used to put the YouTube link and the attendance the slots are almost getting over আৰু এটা দুটা slots বাকি আছে so in the next time also if by chance I take your class I won't be able to upload it in the YouTube channel. Even if I upload, you won't be able to see because it would do our slots thake portal our teachers for our teachers also slots used to be there. So that one is almost getting over. So how much I can, I will complete your class and whatever is left, I will give you the notes in your WhatsApp group. Okay. So PSM theory, I want to take your PSM theory. So write down the topic delivery of healthcare system. Topic to likha etu notun chapter hoy delivery of healthcare system. Delivery 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 of healthcare system. Are you able to see the screen?
Yes, ma'am.
Okay, so delivery of healthcare system. It was a notun chapter hoy. Okay, if you want, you can even see your syllabus. Tomar syllabus asana nai? Do you have the syllabus? I think I have given you the syllabus long time back.
Yes, ma'am.
Okay, so you can check the syllabus. That as a delivery of healthcare system. It's a notun chapter hoy. So write down. Health services are designed to meet the health needs of the community through the use of available knowledge and resources. Without knowledge, you won't be able to do anything. Okay, Jodi, even if you work in hospital setting, you will need knowledge because you will be treating human beings. Okay, you will be treating a live human being, be it a baby, be it an adult, be it an old age people. So we all are human beings. You are not treating an animal. So hey karne, you should have adequate knowledge about the procedure, about whatever you are studying. You should have a thorough knowledge about your own study. Okay, and resources. Resources means in a hospital setting, what are the resources that are required? Equipments lagibo. Okay, salines lagibo, then injections, bed cover, bed, bisnao lagibo, okay, for the patient, trolley lagibo. Okay, there should be pen, paper, there should be a table. Okay, and there are many other things that are required. Urine sample collect koribo karone you will need urine sample or eta thake. Okay, sample collecting box, then first aid box. There are so many things that are required to build up a hospital setting. Just hospital means just at a room or hospital hoy gol eteneka nohoy. Hospital means there are many things that are required. Even people are required. Okay, technicians are required. Okay, radiographic technicians are required, dialysis technicians are required, optometry technicians are required. Okay, whatever you all are studying, DPT, physiotherapists are required, nurses are required, doctors are required, staffs are required. So all this comes under resources. So jodi tumar knowledge nai or resources to kom tene hole it will never be able to be a successful setting. Okay. It is not possible to define a fixed role for health services with the socio-economic pattern of one country differ so much from another. Like a developed country aru developing country, there is a vast difference. Our developing countries like for example India is a developing country. Okay, America is already a developed country, so whatever resources and whatever equipments are present there, all those everything we might not have. Okay, we might not have all the resources and all the equipments here available in India, but slowly as we are developing, like we will also innovate. It will take time. Okay, so it's different from country to country. Ako, if you see Nigeria, okay, if you see all those Africa, so these are underdeveloped countries. So there the resources will be very less. Ako, it will be more lesser than India. Compared to India, the things, the resources, hospital setting, manu, okay, education level, everything will be very less. So one country to another country, it differs a lot. The health services are delivered by the health system, which constitutes the management sector and involves organizational matters. In every setting, there is a management sector. Okay, management sector is always required because that management sector, they all the roles that need to be played, all the things, equipment, kiman lagibo, how many beds should be there, okay, how many saline bottles are required, how many nurses are required, how many technicians, how many doctors are required, okay, how many laptops, how many computers. So whatever be it, it is all done by the management sector, a person who manages everything. Okay, all the roles of different people are different in their own sectors. So management sector is always there, and it involves organizational matters. Without an organization, management will never be successful. Okay, it goes hand in hand. So that is the meaning of healthcare delivery system. Aru in healthcare delivery, it's a simple model. It is a simple model that includes health status or health problem of the people and the resources. Okay, so in this, these two will lead to curative, preventive, and promotive. Okay, curative means to cure any kind of disease, any kind of illness, any kind of infection. Okay, it is known as curative measure. Like for example, jodi tumar fever hoy ase, so as a curative, what will you take? You will take paracetamol so that you can cure yourself. Okay, if you have stomach pain, what you will take? You will take metronidazole. So these are some just examples that I'm giving you. And preventive means to prevent, any kinds of same disease or infection or illness. It is known as preventive. Preventive means, for example, that yeah, when you were small, when you were babies, at that time you were given polio vaccine. Okay, you were giving BCG vaccine, tetanus vaccine, all these vaccines. Why were you given? So that it can prevent you from the future diseases, that all those diseases will be prevented. Okay, next is promotive. Promotive means to promote the well-being of the people or good health of the people. It will lead to public sector, private sector, voluntary, and indigenous. Voluntary means public, private, we will discuss it in the next line. Voluntary means all those voluntary agencies or the voluntary sectors. Like for example, like your NGO. I guess you have heard na NGOs. NGOs are there. NGO, then Red Cross Society. Okay, then Bharat Sevak Samaj. So all these are voluntary agencies. Okay, that are run by a set of people. Okay, indigenous, again you will learn here what is indigenous. Okay, all this Ayurveda system, unregistered practitioners, they comes under the indigenous form. Next is it will ultimately lead to changes in health status of the people and community as a whole. So this is a model. Okay, তাৰপিছত তোমাৰ healthcare system, ইয়াত public health sector আছে, private sector, indigenous, voluntary, and national health programs. So in the public health sector, you will get sub-centers, PHE, CHE. I guess you have heard about it. Have you heard PHE and all? PHE, especially in rural areas, you will get PHEs. Okay, have you heard of PHEs? Anyone? PHCs মানে কি? Primary health care centers. Okay, primary healthcare centers. All this comes under your sub-centers. Okay, especially in the rural areas, in the villages. তাৰপিছত তোমাৰ hospitals, health centers, community health center, rural hospital, okay, district hospital, health center, then specialist hospital, teaching hospital. Okay, all this comes under your public health sector. Teaching hospital means what? Teaching hospital mane where you can work as well as you can study. For example, tomar GNRC, Guwahati Medical College and Hospital. Okay, it is a government it is a government hospital, but there you can study also. At the same time, you can work also. Patient care is also given there. Okay, SMCH, Silchar Medical College and Hospital. They are also same. You will get to study also, plus you will be working also. Patient will also be there. Aro tomar downtown to where you are studying now presently, downtown university. So downtown duta bhag ase, eta hol tomar downtown university. It is a teaching hospital. Means in downtown university, students are studying. They are getting more knowledge. Okay, they are getting to come across various fields. Okay, DRT, DPT, aru bahut khini fields ase. So we are teaching. Aru eta ase tomar downtown hospital. It is the same. Okay, downtown hospital and downtown university location is different, into it comes under one organization. So in downtown hospital, maris used to be there, patients, and patient care is given. It's like a hospital, totally hospital. So all these are known as teaching hospital. তাৰপিছত তোমাৰ health insurance schemes. Okay, all these are health insurance. I guess you know what is health insurance. Then employee state insurance, central government health scheme, aru other agencies tomar defense aru railway services. So all this comes under your other agencies. Private sector aru specialist hospital means it's very much specialized. Aru the instruments and all are very much highly equipped. For example, Ayurveda hospital. Okay, it's in Guwahati only. Ayurveda hospital is also known as specialist hospital. Okay, next is your private sector. Private sector like polyclinics, nursing homes, dispensary. Okay, then general practitioner clinics. All this comes under private. Next is indigenous, Ayurveda, Siddha, Unani, then homeopathy, unregistered practitioners. All this comes under your indigenous system. Okay, I guess you all know what is Ayurveda, Unani, homeopathy. We have already discussed in unit 1. So I won't discuss again because we have lack of time also. Next, voluntary, I already told you it. In voluntary, you will get NGOs. Okay, then Red Cross Society. Okay, Bharat Sevak Samaj, all this comes under voluntary health agencies. Next is your national health programs. In national health programs, you will get to know about malaria program, TB program. Okay. Next is the functions of PHC, primary health center. Function ki ase? That is to provide medical care to the people. Then MCH, including family planning. MCH mane mother and child health. Mother and child health. Okay, the health of both the mother and child. Okay, when the mother is pregnant, at the time of delivery, during delivery, and after delivery, post delivery, pre-delivery, post delivery, and during delivery, the care that should be given to a mother, to a nurturing mother. Okay, and the child care. So it's known as mother and child health. MCH or full form hoy mother and child health, which also includes family planning. Family planning mane the government has already implemented that only 2 child should be, that every family should have only 2 child. Okay, only 2 child should be done for every family, because you all know that India is the second largest population. So there someday it will be that our population will outburst. What will happen? People will suffer from various kinds of diseases. Okay, various kinds of pollution. Pollution is already there, kintu aru bari jabo. Then global warming. Okay, then overcrowding. So because of all these things, family planning is very much essential and required by seeing the present scenario. Next is safe and clean drinking water, basic sanitation, prevention and control of endemic diseases, okay, like your measles, smallpox, ebor. Then collecting and reporting of vital statistics. Vital statistics mane tumar mortality and morbidity. In mortality, we have studied about the statistics, right? So infant mortality rate, child mortality rate, all this also comes under the vital statistics. Then education about health, okay, to provide basic knowledge and basic knowledge, okay, to the common people. It all comes under education about health. Next is the national health programs, that is about TB, malaria, okay, about measles. So various kinds of health programs are there given by WHO and other organizations also. As relevant to likhibo nalage. Okay, then next is your referral services. Last is training of health guides, health workers, local guides, and health assistant. Last is basic laboratory services. All those people who are working in labs, okay, all the services should be provided even to those people. Our local dies, it is especially to Marhari. You will get in rural areas, okay, all those untrained, especially women, untrained women who used to do delivery of mother, okay, without any certificate, okay, without any training. What they do, they used to do delivery of babies, okay. So the government, what they did, because everyone is not that well to do that they can come to hospital. Aru bote ase that in rural areas there are not proper instant help or karoneo nai, then hospital setting nai, so he karone this local dies, they are also very much helpful. Okay, suddenly a mother's time has come to deliver a baby, aru kunu nai, then who will do? So all these local guys are also present in rural areas. So etia government mute yourself. Etia government ki korise for local guys also there is training provided. Okay, with 2-3 months of training. Please mute yourself. Mute Kora, mute yourself, whoever is unmuted. Buji napaye ne. Tarpisot in local dice, what will happen? The government will provide training. Okay, at least 2-3 months of training, and they will also get certificate, and after that certificate and training, they will be able to deliver the babies more in a trained manner, because they are not trained people. Okay, only because of experience they are doing all this delivery in rural areas. So etia even government is allowing them to undergo certain training, basic training. Okay, next is your immunization schedule. In immunization schedule, national immunization schedule will get TT1, TT2. TT mane tetanus toxoid. Okay, the full form of TT is tetanus toxoid. So it is given early in pregnancy, 0.5 ml intramuscularly in the upper. Intramuscularly means in the muscles. Okay, upper arm. TT2 is tetanus toxoid. Second dose. First dose early in pregnancy 0.5 ml. Then second dose will be given after 4 weeks after TT1. After TT1 is given, after 30 weeks, you will have to give another dose of tetanus toxoid, to the mother. Same amount, 0.5. Tarpisot TT booster. After first and second dose comes the booster dose. In booster dose, if received 2 TT doses in a pregnancy within the last 3 years, within the last 3 years, okay, this mother will have to take a booster dose. Same 0.5 ml in the upper arm. Tarpisot for infants, BCG. So write down the full form. Ekini notes kini ete likhibo nalage. Okay, I will send you PDF. in your WhatsApp group. So just BCG full form to likha. Write down the in a piece of in your exercise, write down the full form of BCG. I can ask you for multiple choice question, fill in the blanks. Okay, the full form of BCG to likha. Bacilli, BACILLE, BACILLE, Bacilli. C is for calmette, CALMETTE, Bacilli calmette, CALMETTE, calmette. So last is G. G is for urine, GUERIN, urine, Bacilli calmette, urine. It is the full form of BCG. So BCG for what is the purpose of giving BCG? It protects us against tuberculosis. Okay, against TB. Do you know what is TB? Anyone? Tuberculosis শুনিছিলা নে আগতে? Have you heard of tuberculosis?
Yes, ma'am.
TB. শুনিছা না নাই TB? ইমান common disease হয়. কোনে শুনিছা? Anyone? Darshana? Okay. So tuberculosis to ki hoy? Itu eta airborne infection hoy. Aru itu communicable disease hoy. Communicable disease means it can spread from one person to another. Like your tuberculosis, measles, smallpox, ebor sob communicable disease hoy. Communicable itself means that can spread from one person to another. Aru non-communicable means that doesn't spread from one person to another. For example, jodi mur kidney disease ase tumaru hobo boli nohoy. Okay, so all these are like hypertension, high BP, diabetes. Okay, just by touching me you will never get diabetes. Okay, if sometimes it is hereditary, just by touching or just by sneezing you will not get infected by hypertension. Okay, diabetes, kidney disease, heart disease. So all this comes under non-communicable, and communicables are TB, cough, okay, measles, smallpox, chickenpox. All these are communicable disease that can spread from one person to another. So what happens? A person who coughs, okay, coughs regularly for more than 1 week, okay, or more than 1 to 2 weeks, then the person should go for a checkup. Okay, then, and sometimes what happens, the person who is suffering from TB, along with the cough, blood also comes out, blood stain also comes out along with the cough. So that indicates that the person is suffering from TB, and it mainly affects the lungs, that is the upper respiratory tract. Okay, and the person might also suffer from weight loss. Okay, how much he eats, he won't be able to eat properly, so he will have weight loss, jor hobo. Okay, then night sweat hole means rati hole, at night the person will sweat. Okay, the person will sweat like anything. So these are some of the symptoms of TB. So itu nohobo karne at birth, as soon as you are born or as early as possible till 1 year of age, infants should be given a dose of BCG. Okay, before 1 year you have to take BCG, and dose to hoy tumar 0.1 ml intradermally left upper arm. Intradermally means just beneath the skin. Intramuscularly okhoman deep hobo, okay, because it will have to touch the muscles. Intradermally mane dermis, that is just below your skin. Okhoman bitorote the nurse will give you the medicine. Okay, next is hepatitis B vaccine. It should be given before 24 hours after birth. 0.5 it will into intramuscularly dibo lagibo in the mid thigh. Okay, next is OPV, OPV means oral polio vaccine. I guess you all have taken oral polio vaccine when you were small. The first time tomorrow zero dose. Zero dose, it is given at birth or as early as within 15 days. You should take the OPV vaccine. Aru, duta drop, 2 drop oral. Oral means through your mouth, okay, orally. Then OPV first dose, OPV second dose, OPV third dose. First dose is given at 6 weeks, second dose is given at 10 weeks, and third dose is given at 14 weeks. Same, 2 drops. Tarpisot tomorrow I have DPT. DPT is a combination of 3 diseases. Okay, so write down the full form of DPT. D full form to likha. What is the full form of DPT? D लिखा diphtheria, DIPH, diphtheria. DPT first D আছে, D full form to लिखा diphtheria, DIPHTHERIA, diphtheria. P लिखा, P is for pertussis, PERTUSIS, pertussis. PERTUSIS, pertussis is also known as whooping cough. Okay, pertussis. Last to likha tetanus. Tetanus, TETANUS, tetanus. So these 3 infectious disease, okay, these 3 infectious disease, okay, DPT, it will atta vaccine. In one vaccine only, you will get a combination of these 3 infectious disease. DPT first dose, DPT second dose, DPT third dose. Same, along with OPV vaccine for infant, 6 weeks of first dose dibo lagibo, 10 weeks of second dose, and 14 weeks of third dose. Kintu itu dibo tumar intramuscularly in your muscles, in the mid thigh, in the thigh. Okay. Next is hepatitis B 1, 2, 3. 1 mane first dose, second dose, third dose. Same at 6 weeks, 10 weeks, 14 weeks. So all these things, OPV, DPT or hepatitis B, it will be given at the same time. Okay, one will be have to taken orally, or duta tumor in the muscles, in the mid thigh, it will be given. Next is your measles. That is after within 9 months to 12 months, measles vaccine is given. Last is vitamin A at 9 months along with measles vaccine. Measles or vitamin A first dose to ekelage diya jabo. Okay, 0.5 ml subcutaneously in the upper arm. Okay, then this is a 1 ml orally it will be given. It is a syrup. Vitamin A is a syrup. Okay, just like cough syrup, so vitamin A is also like a syrup. It will be given at 9 months along with measles vaccine orally. Next, more children. Children or DPT booster 1, 2, 3. After the first, second, and third dose, booster dose will be given at 16 to 24 months. Ako OPV booster dibo lagibo 16 to 24 months. Measles 16 to 24 months. Next is Japanese encephalitis. Japanese encephalitis is mainly caused by mosquito. Okay, it is a very dangerous disease that can affect most of the people. Okay, night sweat, fever, these are the symptoms of Japanese encephalitis. So it should be given at 16 to 24 months along with DPT and OPV booster. So DPT booster, OPV booster, Japanese encephalitis, etu ekeloge diya jabo. 0.5 aru OPV to orally dibo lagibo, then measles subcutaneously, aru Japanese encephalitis subcutaneously. Next is vitamin A, second to 9 dose, 16 months along with DPT and OPV booster. So all now before it was given only 1 ml, into 2 ml. Okay, 2 ml diya jabo orally. Next is DPT booster and TT. So this is the immunization schedule of India. Okay, it's only for India. So you all will have to know this by heart. Okay, pura by heart koribo lagibo this immunization schedule, very important. Okay, so this is all about your delivery of healthcare system. Okay, and the notes kini I will give you in your WhatsApp group. Okay then, thank you.
Thank you, ma'am.